See, when you're in the center range of animal product intake, most Americans are consuming 30% of their diet or more. Between 10 and 20 or 10 and 25, genetics play more of a role because some of these population studies, so as people lower their animal product intake, they have less heart attack and less cancer. But there's still heart attack and cancer there. The people that are more genetically susceptible are going to still get heart attack and cancer as you lower animal product intake to 15 and 20% and even 10%. You don't see heart disease become reversible, and you don't see populations with almost no heart disease until you get below 10%. You don't really see it predicted reversal until below 5%. In other words, what I'm saying that once you're above 20 or 30%, then everybody develops heart disease. It doesn't matter what your genetics are. You're all going to develop heart disease. Even the people with good genetics develop disease, eating so much animal products. And in the middle range, then genetics play more of a role because some people have, worse tendencies to develop certain things. But then when you get to the low amount, 5% or less, now it doesn't matter what your genetics are, because nobody develops heart disease when your diet is that favorable. It has so much with 95% of healthy vegetation in it. Do you want to feel? You understand what I'm saying right now? I'm saying that the bell-shaped curve narrows because the bell-shaped curve is way wide on an American diet. People may live to be around 79 years old, let's say 80 years old, but for every person who lives to be 100, like 1 in 1,000, but then every person lives to be 90, 10 years more, then the same amount of people live 10 years less. One person lives to be 95, 15 years more, than the same amount of people live 15 years less. It's a bell shaped around there, a wide bell. You don't know, it's a crapshoot of where you're going to die. 60, 70, 75, 80, 85, it's all going to... But when you're on a nutritarian diet, the bell narrows. It shifts 20 years old, but it gets narrow. Now even people with weak genetics live to be 95. You following that? Because I have so many thousands and thousands of people who have been my patient now for more than 20 years. It's amazing how well they're doing. And they weren't healthy. They came to me because they were sickly in their 50s and 60s and 70s. So here's a research study, a pilot study on diabetes, show that these people within 6 months didn't improve their diabetic parameters. Their hemoglobin A1C went from an average of 8.2 to 5.8 off medications while the medications were stopped. The people became non-diabetic, meaning their glucose levels were normal without the need for medication. You could say they're still prone to diabetic. Sure, they're still diabetic prone if they gain weight back, but not if they keep healthy. And the longer they're on a healthy diet, the less diabetic prone they'll be, and the more repair the body will do to protect them and rejuvenate their beta cells. The most serious cases, like Julia, who had 3 heart attacks in 3 months and 5 angioplasties in 3 years. Now, we were taught in medical school that people are usually dead with their 3rd heart attack. People don't usually survive their 3rd heart attack. I don't know how she ever survived, but she wasn't really surviving much because she couldn't even get out of a wheelchair. She came to my office in a wheelchair, 100 pounds overweight, of course, but she couldn't move out of the wheelchair because of chest pain. Another case sent home to die, like Ronnie. So she lost about 120 pounds or 100 pounds, and she has a full life again. I danced with Julia at her son's wedding. They had a nutritarian wedding. Here's another case study. I don't have much time, I better conclude these cases, but here's a guy sent to me by his nephrologist with abnormal kidney function on 175 units a day. And while he was taking 175 units of insulin a day, his blood sugars were still running over 300. Incredible. The doctor's giving him more drugs and more drugs and more drugs, but until you clean up the diet, you can't help this person. More cases, one after another after another. There's a guy with a carotid artery occluded, and in 1 year, his carotid artery occlusion in 1 year went from 60 to 80% to 40% in 1 year. In other words, he dropped the percent of occlusion by 20% in 1 year. Second year, the doctor couldn't see any occluded artery in there in 2 years' time. Might have took him 20 years to build it up there. Only took him 2 years to get rid of it. And the people who develop atrial fibrillation, many of them, some of which developed on a low-fat vegan diet, who come to see me, and that we determined, do blood, check their fatty acids, check their DHA, and a lot of these people are able to do well again. And I've been in practice with all these years, seeing many people whose lives have been in some way hurt by the extremely low-fat vegan diet, mostly from depression and dementia in later life. And I have to speak up about it because it's very important not to have anybody hurt by radical advice, when you don't need to be hurt. To reiterate, to sum this up, the goal is not to eat a diet low in fat. The goal is to have a low body fat. Right? Get the fat off you. Yes, eat less calories. Yes, keep your calories low enough so you're losing at least 2 pounds a week. Let me say this one more time. If you're a nutritarian, you're at your ideal weight, or you're on the way there. And if you're not on the way there, you're not on a nutritarian diet. The nutritarian diet is not snacking on nuts and not overeating either. It's eating the right amount of calories, and it's taking space between meals, waiting till you get hungry, and controlling the amount of calories you eat so you're not eating to stuff yourself to oblivion. Controlling what you're eating so you're losing weight, and how you control, if you're no longer in touch with hunger and you're too much of a food addict, then you got to weigh yourself on a scale to make sure you're controlling your food intake so you're losing 1 pound every 3 days. And if you're not losing 1 pound every 3 days, then you're overeating. Because if you're overweight and you're eating a nutritarian diet properly, and I know from experience of doing this with thousands of people, when they follow the diet and I'm controlling what they eat and I'm giving them the right amount of food they're supposed to be eating, they're losing at least 1 pound every 3 days. Only the people not following it are not. And when you're losing 2 pounds a week or 1 pound every 3 days, then you're seeing the diabetic parameters being repaired even before you lost all the weight, and you're seeing the insulin resistance decrease, and you're seeing the cells stop producing so much estrogen. In other words, you're starting to undo some of the damage as you're losing weight, even while you're still overweight, right? So we diffuse the time bomb right away. Within days, we're decreasing the risk of having a heart attack or following the program. Within days, not within months. So the conclusion is that heart disease, diabetes, obesity, all these things are curable, reversible, but most doctors' and dietitians' advice is pretty worthless. You might as well go and get your mailman. And moderation kills, because disease still advances. It's not just the fat you're eating, and a vegan diet is not sufficient because it's not designed to maximally reverse disease. We've got to design it and tweak it to make it optimally favorable with the amount of how much you're eating, how frequently you're eating, what you're eating, and make sure your diet is truly excellent. So if you have diabetes, read my book, The End of Heart Disease. No, I said that wrong. If you have diabetes, read my book, The End of Diabetes. If you have high blood pressure or high cholesterol, the more you read and the more you study and the more you know, it motivates you to stay on the plan. The ability to do this and stick with it has to do with your knowledge base. We find that as people know more, they stick with it better. For people who are dyed-in-the-wool food addicts, who can't control their appetite and can't control what they're doing, they should come in and stay with me. They should be treated by me. If you know a diabetic, a person with heart disease, they should not be sick anymore. And if they think they can't do this, then they should come in and let us save their life. Why die? I take care of these people, and I have a professional staff of professional psychologists and chefs that make the best tasting food in the world, but the psychologists deal with the people's emotional and psychological issues that due to their food addiction or alcohol addiction, where they really get to the root of their addictive eating behaviors. And that, combined with the time and distance away from those triggers that take them into an addict, enables the people to change their outlook on life, to change their personality, and to be able to do this when they go home. I think I mentioned yesterday that they did mention today this guy who came in with heart disease, who lost 70 pounds in the first 3 months. Remember I mentioned him a few minutes ago? Well, now he has the ability to stay with the program. If he went to some place and he ate healthy for a week or two, he learned how to change his life so he can do this on his own now. And he's enjoying it, and he's thrilled by it, excited by it. And he's no longer being pulled to eat those foods he could not control his behavior. I want you to be able to do this on your own. I want you to have the mental fortitude and knowledge and to do this. And you can do it on your own. And we even support people through the drfuhrman.com website. We support people with putting people together with community and with information and making it easy for people. But even for people who can't do it on their own, my point is now, they should do it too. We shouldn't have people killing themselves with food. So a beautiful place, it's just incredible there, the great food. So my website is drfuhrman.com. My books are all sold out here. So if you need to get this book for a relative or a friend, get the right book that's made for them. If they have an autoimmune condition or predisposition or family history of cancer, they should get super immunity. If they have heart disease or high blood pressure, the end of heart disease. If they're a yo-yo dieter and a food addict, the end of dieting. With diabetes, the end of diabetes. They all have similar information in them, but they're tweaked a little bit to really feel they're addressing that person's problem. Excuse me? Oh, disease-proof your child. Yeah, I'm not mentioning every book that I've written. This is not an ad for Dr. Fuhrman, but it is. Now, I'm also president of the Nutritional Research Foundation, which means a nonprofit organization where we do nutritional research, and we have an office in Northern Arizona University in Flagstaff, Arizona. And we do research, and we're doing so. If any of you want to either look into that research or help support that research, go to nutritionalresearch.org and read more about what we do there. Okay. Great to see you guys. Great. Always. Thank you. Thank you. Thanks so much. Wishing you all the best. And if I can help you in any way, don't hesitate to ask. Thank you so much.